Hi, myself I am Dr. G.P. Reddy, veterinary doctor. In this channel, we will be discussing mostly about the diseases related to dogs and cats and the managemental aspects of dogs and cats. Today, we will be discussing about canine parvovirus. Why is it important? How it spreads? What are the susceptible age groups it is affecting? Symptoms seen in them. What is the treatment and the duration of the treatment? What is the preventive measures we can take to control the disease? First one is why the disease is important. It is a deadly disease and very commonly seen mostly in the puppies. If not treated in the early stages, chances of survival will be very less. It needs a lot of intensive therapy for a period of 7 to 10 days, where drip should be given daily, morning and evening. How it spreads? Direct contact with the infected animal and or contact with the stools of the infected animal. Virus stays in the environment for a long period of time. Feces is often carried on a dog's hair or paws and can be easily transferred to a human body, clothing or shoes. Urban areas are seen to be more susceptible in spreading the virus, as the virus is carried on their shoes to their home and left for our dogs to be infected. If a dog sniffs or licks contaminated surface, then they will get the infection. Virus can contaminate the kennel surface, food bowl and also water bowls of them. Susceptible age groups. It affects all age groups of the dog. Most susceptible age groups are from 6th week to 6th month. 6th week to 6th month age group of puppies are most susceptible in getting the infection. And the breeds which are more commonly affected are Doberman, Rottweiler, German Shepherd, Labrador and the Indie puppies, Indie street dogs. They will also be getting the infection more commonly. The symptoms that can be seen are: first common symptom is puppy will be dull, will not show any interest in taking the food, will be very sick, sleeping always, and will not respond to the name calls. There will be abdominal pain and bloating. Some of the puppies will show fever, some doesn't exhibit that fever. The most common important thing is vomiting, and there will be severe bloody diarrhea with foul smell. Due to continuous vomiting and diarrhea, it causes rapid dehydration and it damages to the intestine, which causes septic shock. Most deaths from parvovirus occurs within 48 to 72 hours following onset of clinical signs. If the puppy or dog shows any of the above signs, you should contact your veterinarian immediately. The most common signs which you will be seeing are vomition and bloody diarrhea with foul smell. These are the most common symptoms. And next, the treatment. First, animal should be or pet should be isolated, should not be allowed to interact with other puppies or any dogs which are present at home. Immunoglobulin administration. Fluid therapy should be given continuously to overcome dehydration. Daily, morning and evening. Fluids, drips such as DNAs and RL should be given to correct the electrolyte imbalance. And antiemetics, antidiarrheal, antibiotics such as licks, cephalosporin such as ceftriaxone, cefotaxime are most commonly administered. Treatment takes around 7 to 10 days to recover the puppy. How to prevent them? The prevention is by regular vaccination. Whenever you get a puppy, first you have to vaccinate it for parvovirus. First vaccination can be done in the 30th day, and the subsequent vaccination can be given over once they are of 6 weeks, and again once they are of 10-week age, once they crosses 14th week. Thus all vaccination should be given. Do not take puppy to interact with unvaccinated and any other dog till vaccination is completed. People who are in contact with sick or exposed dogs should avoid handling other dogs, at least wash their hands and change their clothes before handling the puppies or dogs at their home. Finally, don't let your puppy or adult dog to come in contact with fecal waste of other dogs while walking or while playing in the outdoors. Thank you. Please subscribe to our channel.